galawin niyo ang tenga ko, galawin niyo ang tenga ko. Hanggang mamaya, hindi na po ako makapagsalita, murong na po yung dila ko. At yun, tinakbo na po ako ng ospital.
There are several risk factors, okay? Mostly are the vascular risk factors, no? Primarily, for the Filipinos, it's hypertension.
So some patients would complain of visual disturbance or loss of vision in one side or on the other side, or like growing blind spot.
Studies show that stroke is one of the leading causes of death and the leading cause of disability here in the Philippines. So understanding the condition, knowing its warning signs, and understanding what treatments are available will make a huge difference. Because when it comes to stroke, time is of the essence. I'm Dr. Freddy Gomez. Welcome to MedTalk Health Talk. Stroke symptoms often happen suddenly, and each person may exhibit different warning signs. Let's listen to one stroke survivor and his journey.
Hi, ako po si Jingle Ocampo, stroke survivor po. Actually, hindi po ako nagsisigarilyo at umiinom ng alak. Kaya tinigil ko po na siya ng 20 years ago dahil bugbog din po ang sarili ko sa mga inom-inuman sa sigarilyo na yan. Pero kahit papano, nakapag-exercise ako o pinagpapawisan ako pag nasa event kami dahil meron po kaming malit na business na pinagkakakitaan para ayun, doon po ako pinagpapawisan. Pero simulan na umpisa yung pandemya, hindi na po ako nakapagpawisan dahil nandito lang po sa bahay. Sa tingin ko, medyo kasama po dahil gawa po ng pandemya dahil sobrang lungkot. Isa na rin yung unhealthy food, pagkain ng mga mahilig po ako sa mga fast food, mga french fries, chicken, yan. Mahilig po ako sa mga mamantika, mga oily food, saka maaalat na pagkain. Actually po, wala pong sign na akong naramdaman ng araw na yun. Ang tanging ginagawa ko, natatandaan ko, ng gabi ng July 31, 2020, madaling araw yun, alas 12 madaling araw, halos sa August 1 na po yun. Nagsiselfone po ako. Nakaupo sa taas namin. Tapos nakaramdam ako ng pag-CR po. Nag-CR po ako. Pagkatapos umakit na po ako sa taas namin. At bumalik sa pag-cellphone namin. At ito po ang gamit ko. Medyo nakaramdam ako ng panghihina po. Sabi ko, tulungan niyo ako. Yung cellphone ko nahulog. Di ko po makuha. Buti na lang, nandiyan po ang pamilya ko para sakluluhan ako. Hindi ko po alam na stroke na po ako. Unti-unting nanghihina yung kamay ko. Hindi ko makagalaw. Tapos, sabi ko, galawin niyo ang tenga ko, galawin niyo ang tenga ko. Hanggang mamaya, hindi na po ako makapagsalita. Murong na po yung dila ko. At yun, tinakbo na po ako ng ospital. Ang natatandaan ko po ng panahon na yun, tinakbo nga po ako dahil punong-puno po ang mga ospital. Hindi po ako ma-accept, ma-admit sa ospital. Nandun lang po ako sa lobby ng ospital. Doon lang po na parang tawag, parang stretcher o higaan. Nandun lang po ako. Hindi ko alam po yung mga ini-injection sa akin. Basta inaasikaso naman po ako sa awa ng Diyos. Nakita ko sa mga records ko po, minsan nag-check ako ng aking mga files, mga na sinuwab po rin po ako. Tapos, ayun, hindi ko na po alam yung mga itinturok sa akin, pero alam ko, pampaluwag ng yun ang ini-injection sa akin. Dahil sinurehan na rin po ako Na-confine po ako sa ospital. Medyo matagal po ako sa ospital. 17, nakadalawang ospital po kasi ako dahil di po ako ma-admit yan. Kaya linipat po ako ng ospital. Sa isang ospital na pinuntahan ko, 17 days po ako ron. Hindi po ako pinapalabas ng dahil nga po hindi ko po makilala yung mga family ko. Tinanong ko ng doktor kung sino siya, hindi ko po masagot. Kaya hindi ko pinalabas, saka utal-utal talagang murong po dila ko ron. Ayun po, napakalaga ng suporta ng pamilya niyo po. Dahil depression po, itong sakit na to, depression po, pag hindi ka susuporta ng pamilya mo sa buhay. Naranasan ko rin po yun, yung ma-depression ako na ganun. Pero kaya nandiyan sila, suportahan, lalo na bagsak ang buhay namin dahil nga sa pandemya na yan. Nandiyan sila, mga kapatid ko, kaibigan, para suportahan ako at tulungan, kamustahin, kahit sa pamamagitan lang ng text o chat-chat, kinakamusta po nila ako. Within 6 months, nandito lang po ako sa bahay namin. Hindi po ako lumalabas ng bahay. Nag-exercise ako dito pero hindi ako lumalabas dahil sa sobrang hiya ko sa nangyayari sa buhay ko. Hanggang sabihan ako ng mga kapitbahay namin na lumabas ka. Walang ibang tutulong sa'yo kundi sarili mo. Kaya nag-isip po ako ron. Sabi ko, lalabas ako. 6 months, doon po ako nag-exercise sa labas, just sa court namin. Napakahalaga po ng araw na yun para lumakas ang katawan ko. Naghalos ang itim-itim ko dati para magpa-araw palagi para lumakas. Awa ng Diyos, ito na po ako. Ang natatanda ko po, ito ang hindi ko makakalimutan, yung kabilin-bilin na sa akin ng doktor na kung ayaw mo ma-stroke again o second stroke, kailangan iwasan mo ang maaalat na pagkain. Iwasan kong mamamantikang pagkain saka maalat na pagkain. Lagi rin po kailangan mag-exercise ako. Iwasan ko ang bisyo. Total, hindi na po ako nag-bisyo. Dahil ayan po ang pinanggagalingan din po ng stroke Yung sigarilyo nga saka unhealthy food. Kailangan iwasan na po natin yan, yung mamamantika na yan. Dahil kailangan mag-juicing-juicing lalo po saka mga gulay. Napakalaga po niyan. Iwas din po tayo sa stress. Isa rin po sa nagpapa-stress na yan. Siguro po masasabi ko sa mga kapwa ko may stroke o mga survivor. Sundin po natin yung binilin sa atin ng wag natin babaliwalain yung binilin sa atin ng mga doktor. Kailangan po natin yung maintenance natin. Araw-araw inumin po natin yun. Umiwas din po tayo sa mga oily foods, mga unhealthy food, mga fast food. Lagi po kayo mag-exercise. Napakahalaga po ng exercise. Kailangan po natin yan. Kailangan maging routine na natin sa buhay natin yung palagi tayo mag-exercise. Iwas din po tayo sa mga bisyo-bisyo at iwas din po tayo sa mga stress. Isa rin po sa nakaka-stroke po yan. Titignan yung ang stress. Hindi nakaka-stroke po yan. Kabilin-bilinan po ng doktor yan po. Nagtatrabaho na po ako ngayon sa mga event. Halos weekly kahit paano, kahit pa isa-isa nakakaroon po. Laking tulong po para sa pamilya. Para kahit paano, yung mga utang na medyo makabawas-bawas pa awat tulong ng Diyos. Kailangan po kasi, kailangan natin lumaban sa nangyari sa atin. Huwag nating lagpasan na natin yung mga depression na yan. Kailangan natin lumaban. Kailangan laban lang po tayo habang may buhay tayo. There's a life after stroke.
When we return, we'll talk to experts to tell us more about stroke symptoms and its risk factors. So keep it here on Med Talk, Health Talk. Our brains are responsible for pretty much everything that we do. So when a stroke happens and the blood supply is cut from our brain, so many effects can happen because of this. Now, to explain more what a stroke is, its effects, and the best way to manage it, we are joined today by Dr. Diane K. Ferrer, who is a neurologist. And we're also joined by Dr. Mary Jane Yu, who is a rehabilitation medicine specialist, and both of them are from the De Los Santos Medical Center. Ano ba yung mga signs na pwedeng makita when someone is having a stroke? Because whenever we are able to spot the symptoms, we have to really act fast or be fast in order to spot this and treat it properly.
Yeah, actually the BFAST is the acronym that we use to spot or to early recognize a stroke. So the B stands for balance, E for eye disturbance. So some patients would complain of visual disturbance or loss of vision in one side or on the other side, or like growing blind spot. And the F stands for facial asymmetry or facial drooping. And the A stands for arm weakness. And S stands for speech disturbance, difficulty talking or difficulty understanding the speech. And the T stands for time to call for the emergency number, 911 or any number in the community for emergency.
Now, if all those symptoms are present, definitely there's a high chance of that person having a stroke. But what if only one or two symptoms are present? Stroke na kaagad din ba yun?
Yes, we only need one of those symptoms or signs for us to recognize, for us to say that it is a stroke and it is time for us to call the emergency response.
Dr. Jane, when it comes to risk factors doon sa mga nagkaka-stroke, are there mga common ones, especially sa ating mga Filipinos?
There are several risk factors, okay? Mostly are the vascular risk factors, no? Primarily, for the Filipinos, it's hypertension. So those uncontrolled hypertension. Second would be smoking. Third, dyslipidemia or elevation of your cholesterol levels. Another risk factor would be obesity, diabetes.
Now, pagdating sa stroke symptoms, Dr. Dayan, you mentioned some red flags na pwede mo makita sa isang tao na pwede siya nagkakaroon ng stroke. Gaano ka-importante na maidala ang taong ito sa hospital or sa treatment center right away?
Yeah, the timing for bringing your patient into the hospital is very critical actually, because we have available medications or management that we can give to our patients presenting with stroke. So number one, the importance is that it will decrease your risk of mortality, and it will also reduce the long-term disability from stroke. So one of the medications that we can give for the ischemic type of stroke, the ischemic type of stroke means that an artery into the brain is being blocked. So we can give this IV thrombolysis. This is a medication that we can give through the vein to dissolve the clot. So this will improve the survival of the patient and also reduce the long-term disability.
Ngayon, when you mentioned the ischemic type of stroke, hemorrhagic type of stroke, ano bang ibig sabihin nito, Doktora?
Okay, so we have two types of stroke. The first one is a ischemic type of stroke wherein the artery leading into your brain is blocked by a clot or by a plaque. And another type of stroke is this hemorrhagic type of stroke wherein this involves bleeding into the brain. And some would have bleeding in between the brain parenchyma and the covering of the brain. So that's what we call subarachnoid hemorrhage. And it usually comes from ruptured aneurysm.
Okay, now when it comes to levels of severity when it comes to stroke, are there any guidelines that our viewers need to know of, Dr. Jane?
Yeah. In terms of the severity as to the symptoms, there is a guideline or a scale that we use, no, which is the NIHSS, okay, the National Institute Health Stroke Scale. That is being used to quantify the severity of the symptoms, which is caused by the infarct or the stroke. This is labeled from mild to severe, depending on the score that you will be garnering from the evaluation of the patient.
If the symptoms are labeled as mild, moderate, severe, and then someone has symptoms that fall under the mild category, sasabihin nilang nagka-mild stroke ako, does this in any way also signify the level of importance? So, pag nagka-mild stroke ako, I don't really need to think of it so much. I don't really need to take any precautions. Mild stroke lang naman eh.
Well, actually, no. Stroke is a stroke. You know, the implication of this is once a patient had a stroke, he has a higher chances of getting another stroke.
When we return, we will discuss preventive measures and the importance of rehabilitation for someone who has undergone a stroke. Keep it right here on MedTalk Health Talk. can cause severe and permanent damage to us. So taking those essential steps every day in your lifestyle that can help prevent a stroke is definitely essential. Now, for those who already suffered a stroke, the key to a good recovery is the timing of your rehabilitation. Now, we're still joined by rehabilitation specialist Dr. Mary Jane Yu and neurologist Dr. Diane K. Ferrer, both from the Los Santos Medical Center. We always try to promote prevention, which is always better than cure here on MedTalk Health Talk. What can someone do? What changes in their lifestyle can they do in order to possibly prevent a stroke from happening? Dr. Jane.
Yeah, lifestyle modification is very crucial in preventing stroke occurrence or even stroke recurrence. One of which is, of course, maintaining your blood pressure at the optimal level. And with that comes along with the compliance of medication. For those patients who are really hypertensive, they have to be compliant with their medication. Second, as it was mentioned, risk factor for the Filipinos is smoking. So cessation of smoking is very important as a lifestyle modification. Diet modification is one lifestyle change that should be observed or practiced by individuals who would have suffered from stroke or who had the risk of developing stroke.
What are the chances of a stroke reoccurring with someone who has already suffered a stroke?
Yeah, actually, 1 out of 4 patients who had stroke had previous stroke already. So it's like 25% of patients will have re-stroke.
Now, is there anything you'd like to add in terms of lifestyle changes that are essential for trying to prevent a stroke from happening or reoccurring?
Yeah, Dr. Jane mentioned the diet. So we recommend to patients who have had stroke to have Mediterranean diet. That means a high intake of fish and low consumption of meat or processed meat. And we have to restrict them from taking sodas.
Now, Dr. Diane, in summary, what should the mindset of our viewers be when it comes to trying to prevent stroke from happening or prevent it from reoccurring?
Well, generally, Dr. Jane mentioned the risk factors earlier: high blood pressure, diabetes mellitus, obesity, and inactivity, and cigarette smoking. So the way to approach this is to manage all these risk factors to prevent having another stroke or having a stroke.
And before we go, do you have any tips, advice for our viewers, Dr. Diane?
Yeah, okay. So for the early recognition of stroke, we have the BFAST, the acronym on how to spot a stroke. And stroke is an emergency, so we have to bring your patients immediately to the ER. And there are a lot of risk factors for stroke, so we have to manage these risk factors for us to not have a stroke or to have a recurrent stroke.
And Dr. Jane, do you have any tips or advice?
So, as mentioned, the timing is very important. And then do not neglect whatever symptom that you notice on an individual. May it be mild, may it be a minor one. Do not neglect. Seek medical consult as soon as possible, for this may affect the outcome of the patient.
And with that, I'd like to thank Dr. Mary Jane Yu, Rehabilitation Medicine Specialist, and Dr. Diane K. Ferrer, Neurologist, for being with us, sharing your information, and giving our viewers, that extra added knowledge, especially when it comes to identifying a stroke, what to do when someone is having a stroke, and the outcome, and of course, the importance of rehabilitation post-stroke. So thank you very much. Strokes can be treated if spotted early, and proper rehabilitation can significantly improve a patient's quality of life. I'm Dr. Freddy Gomez. Thank you for joining us here on MedTalk Health Talk.